A make or break month for healthcare in America. We just spent an hour in a presidential town hall in New Hampshire. Let's hear now from a Republican critic, Texas Representative Pete Olson. He joins me now live from Houston. He was listening to the president's speech. Why don't we begin with the first thing that stands out to you that you have an issue with?
Well, Karen, thanks for having me today. And it was nice to see the president out on the trail like the rest of us. But again, what stuck to me today is the same thing that stuck with me forever. There's a fundamental difference between our side and his side as to what health care reform means. We all agree that we need to reform our health care system. We have problems, but the president sees the government as the solution, and we've got alternatives in the private sector with modifications, changes to the tax code that will bring the American people the health care they want, they need, they deserve at an affordable cost.
But the president made the point, it's not just going to be a government-run system. There's still going to be plenty of options. Let's take a listen.
Under the reform we're proposing, if you like your doctor, you can keep your doctor. If you like your health care plan, you can keep your health care plan. You will not be waiting in any lines. This is not about putting the government in charge of your health insurance. I don't believe anyone should be in charge of your health insurance decisions but you and your doctor.
He's made it pretty clear there. Options, options, options.
Yeah, I hear that, Karen, but what the problem is the president talks about the public option and talks about it being comparative with private sector options, but what he doesn't mention is that the government will determine which private sector options qualify to compete within the public option. And that's going to screen many of them out. There's tremendous problems with small businesses. I mean, one of the big things we're looking at there is a large tax increase on small businesses, up to 8% for those who provide insurance, but not up to the government standards. That's what the president's not telling you, and that's the problem with the federal government being part of the competitive pool.
And he did make a point to talk about small business in New Hampshire and also overall in this country. Let's take a listen.
Small businesses, they end up paying a lot more than large businesses per person for health care because they've got no bargaining power. They've got no leverage. So we want small businesses to be able to buy into this big pool.
He says small business wins.
I'm sorry. Yeah, that's exactly. We support that idea as well as Republicans. I mean, expanding the pool for small businesses. It was called Associated Health Plans a couple of years ago, and that's part of our plan. Certainly, we also think that small businesses should be given tax deductions very similar to corporations. Right now, a small business can't deduct, in some cases, the cost of providing health care insurance to their employees, and that makes no sense.
Well, something else, too, the president wanted to make very clear, because there's been a lot of back and forth on, look, this is overall, this is very much about keeping the insurance companies on their toes, wanting insurance companies to be able to compete, and that, of course, is better for you and me in the long run. Let's take a listen to what the president said.
We also want to make sure that everybody has some options. So there's been talk about this public option. This is where a lot of the idea of government takeover of health care comes from. All we want to do is set up a set of options so that if you don't have health insurance or you're underinsured, you can have the same deal that members of Congress have, which is they can look at a menu of options. We're calling it an exchange, but it's basically just a menu of different health care plans, and you will be able to select the one that suits your family best. And I do think that having a public option as part of that would keep the insurance companies honest.
Congressman, whether Democrat or Republican, we've all felt the sting from an insurance company at least once in our life.
The insurance companies there's some reform that we can be done there. They need to be more transparency. One thing that we think is a good idea too is allowing insurance companies to take their business across state lines. And another thing is that if someone loses their job or changes jobs, there's no reason why their insurance shouldn't follow them. So those are things that we endorse on our side of the aisle. I think can do a better job of fixing our health care problems than what the president plans.
Congressman Pete Olson, thanks for joining us.
Thank you very much. Have a great afternoon.
You too. He left CNN Center in Atlanta yesterday, a man with a mission, shirt untucked.